My specialty is pulmonary and critical care medicine. So from the pulmonary aspect, we treat asthma, chronic obstructive pulmonary disease, patients with fibrotic lung diseases, blood clots in their lungs. That's pretty much the majority of the patients that we see. In the hospital, the critical care aspect, these are patients that are very, very ill and end up in the intensive care unit, and they can have various different maladies, not only lung maladies, but also infections and complications from surgery, etc. There are many times in my profession that patients are distraught, they're concerned, they're anxious. Someone has told them they have a spot on their lung and it might be cancer. Someone has told them they have a terminal disease, and I may have to tell them that. And so the way you approach that becomes important, and you have to have a lot of empathy and compassion and make sure you approach it in a way that has a calming effect on the patient. And you really have to vary that from patient to patient. So you get a feel for how the patient is handling the situation as you talk to them, and you just have a conversation with them. And you try to talk about some of the things they like to do, what's important to them in life, and then you can move on to some of the more serious aspects of their problem. What keeps me most passionate about working every day is seeing a patient that maybe I've seen the month before, 2 months before. We made a diagnosis, we initiated a care plan, having them come back and tell me that they felt better than they have in years. And when that happens, a light turns on in me and says, boy, maybe this is worthwhile. My name is Cantor, MD. I work with Spectrum Health Medical Group in the Division of Pulmonary and Critical Care Medicine.